Hello, I'm Lori Donnelly, co-executive producer of the PBS Future of Work initiative. It's a three-part documentary and digital video series which premiered nationwide this fall on PBS and also on pbs.org. We're delighted to be working with Mental Health America and bringing you what we know will be a meaningful conversation about mental health in the workplace today. Now, our production teams began work on this series just a few months before the lockdown in 2020. And it's an understatement to say that the conversation around work has changed dramatically over these past few years. During this time, many workers have struggled with mental health challenges resulting from isolation, but also from the blurring of lines between home and office. This certainly has been true for workers like Catherine, whose story we'll be watching shortly. The good news is, organizations like Mental Health America are helping highlight solutions, and in so doing, reducing the stigma surrounding conversations about mental health and work, conversations just like the one we're having today. Now, I want to be sure and extend an enormous thanks to our funders for making this event possible, but also to our esteemed panelists for joining us and sharing their perspectives. I hope you enjoy today's conversation and also that you'll visit pbs.org to learn and to watch more about the Future of Work initiative. Thank you so much.
Hello. The theme of 2021 is waking up after 7 to 8 hours of sleep and just feeling like I've been hit by a bus. Like, I remember in college I took a yoga class and it was like 7 a.m. on a Tuesday. And our teacher always told us, like, if there's genuinely a morning where your body's like, hey, don't do it, honey. But then I'm like, what if your body's saying, don't do it, honey, every day? And that's, I guess, why I'm seeing a psychiatrist.
Catherine is a sales executive at a tech firm in San Francisco. Like many office workers, her job has become completely remote since the beginning of the pandemic.
The pandemic changed everything for me. I went from being someone who really valued putting everything into my work, giving it my all. Suddenly, I was at home with 2 times the amount of work, working insane hours. My mental health was crumbling, and I just quickly hit a wall where I realized I just couldn't put in the same amount into my job as I had been before.
I cannot believe this is the same human form and the same body that used to wake up at 5:45, drive to the train station, get on the 6:16 train, go to the gym at 7 a.m. and then start work at 8. Like, who was she? Where did she go?
Hi, everybody. Welcome to today's discussion about the importance of positive workplace mental health now and looking forward. My name is Taylor Adams, and I am the Director of Workplace Mental Health for Mental Health America. I am someone who lives with anxiety and depression and has found, my relationships with the people I work with, my job as a source of support as I kind of navigate those issues. Mental Health America is the nation's leading mental health advocacy organization, led by our before stage 4 philosophy. So essentially treating the signs and symptoms of a mental health condition long before it reaches that point of crisis through prevention and early intervention. I'm excited to moderate today's chat with some knowledgeable and very experienced friends and partners of MHA. But before we get to that, I wanted to share a few housekeeping items. We want this event to be as accessible as possible to all. So for those who are hearing impaired, please access live CART captioning at the link in the chat. In addition, for folks who haven't already introduced themselves, please, I encourage you to share where you're watching from, maybe what industry you work in, and maybe a self-care tip that has really helped support you in the last year and a half or so. So with that said, we'll get started. So today's panel includes a broad range of perspectives and industries, from technology to construction to retail. I'm delighted to, give a brief introduction of our panelists, and then I'll turn it over to them to explain a little bit more about what they do. But first, I'd like to introduce Susie Craig, who is the Chief Strategy Officer for Mental Health Connecticut. Next, I'd like to introduce Megan Lawrence, who is the Director of Accessibility Evangelism and Intersectionality at Microsoft. We have Cal Beyer, who is the Vice President of Workforce Risk and Worker Wellbeing at CSDZ. And finally, I'd like to introduce Joe Emery, who is the Human Resources Director at Hot Topic. So kind of getting into it, can each of you just share briefly what your role is all about and why mental health is so important to the work that we do? And this is for the full panel. And I'd like to open up if Susie, you'd like to get started.
Absolutely. Thank you, Taylor. Welcome to the panelists and everyone. It's wonderful to see everyone. Like PBS, I turned 50 as well this year and grew up with PBS. So this is really exciting for me. I'm a bit of a fangirl. I've been at Mental Health Connecticut for 6 years. The organization has been around for 113. And we are community-based care, and we have an extensive wealth of knowledge and expertise around supporting our staff and then leveraging that expertise to support other workplaces. We do a lot of things, but that's the area that I'll be focusing on today. We are a platinum level Bell Seal recipient for Mental Health America's Bell Seal for Workplace Mental Health. And we are a partner with Mental Health America in helping to create a model that we believe will be effective and supportive for a variety of workplaces to help them really get at this overwhelming question of how do we support our workforce, how do we support our communities, and get them what they need so that they can really build that resiliency and understand how to support themselves around mental health.
Thanks, Susie. Cal, do you want to introduce yourself?
Yeah, thank you very much, Taylor. I've enjoyed our partnership, really focusing in on workplace mental health. I represent the construction industry, but have previously worked in public entities, healthcare, and really done a lot of work in this area before it was popular, before it was acceptable. I'm really proud of how the construction industry has embraced this topic and how we're moving mountains to really break down some of the stigma and improve access to care. I had been working for a construction company for 7 years prior to joining CSDZ, which is part of Holmes Murphy. I returned then to the insurance industry to help focus on changing the culture of the construction industry, to build a caring culture, to knock down those barriers, and to really improve that access to care. I have done almost 200 webinars since the onset of the pandemic. So timing is everything. What a great opportunity to reach new people with a message of hope. And that's what I really appreciate about partnering with you today.
Oh, you're making me blush, Cal. Thank you. Megan, would you like to introduce yourself?
Yes, thank you so much. I am so incredibly humbled and proud to be here on part of Microsoft, in which we really see mental health as a disability. In fact, the number one disability in the world today. And as we've seen COVID, we have recognized that the mental health community is growing. And so we're really beginning to look at not only how do we understand our employee base. So I co-lead the employees with mental health conditions. I myself am a person with a mental health disability, but really leaned into the opportunity, which I will call a COVID silver lining, to really identify and begin to think about a global strategy on mental health that spans benefits, diversity and inclusion, learning and development, and accessibility. So bringing together people from across the company to really understand the opportunity. And being a tech company, we recognize that technology has an interesting role to play in people's mental health and well-being. And so I look forward to talking a little bit more about how technology really could be one of those ways in which people find support, community, and a way to communicate with their friends and family and with healthcare.
Thank you so much, Megan. And finally, Joe, please introduce yourself.
Well, thank you. My name is Joe Emery, and my phone is ringing. I hope you can't hear that through Ring Central. I thought I had turned it off. Of course, it's going to happen. I'm the Director of Human Resources for Hot Topic and Box Lunch. I can't. I I've tried to, I turned it off and it came back up.
It just like, I think it knew the moment you were going to go and introduce yourself. It's like, this will be the time that it happens, right? Yeah. Joe, we'll come back to you there. I just want to put out a quick reminder for folks that are, kind of introducing themselves in the chat. Please drop any like burning questions you have. We do have quite a bit of time at the end of our discussion to answer those questions, so please share that. And yeah, I think I'll kick it off and we'll turn it back to Joe in a little bit, but let's just get started with what is the role and responsibility of employers to create these supportive and psychologically safe workplaces? And how have you seen the shift in employee expectations over the past year and a half? And I wanted to start with Susie to start with your response, but then please, anyone else who wants to jump in, you're more than welcome to.
Thank you, Taylor. So a perfect example right there is, unpredictability and uncertainty in the world that we're living in, right? And having to roll with that unpredictability and uncertainty is something that we have all had experience with in the past couple of years. I believe that's a central theme to the PBS series as well. So I think what we've seen at Mental Health Connecticut when we have worked and continue to work with other organizations is a incredible shift, especially since I've been here for the past 6 years. 6 years ago, having the conversation with organizations was a challenge. It was difficult getting them to see that this was something that it really was something that not they just had to pay attention to, but that could be integral to the success and the health of the organization, which is having these difficult conversations about supporting the mental health of their workforce and employees. And now I do not have that problem anymore. The conversation has shifted into what do we do? How do we do it? How do I build the infrastructure and the systems to make sure that I'm supporting this at a meta level and also supporting it at the micro level programmatically and in different ways to make sure my employees get what they need. So that's an amazing shift. So core to Mental Health Connecticut's mission is creating environments that support long-term health and wellness. The workplace is an environment, right? And every environment has different factors. It's an ecosystem, right? So there is not a one-size-fits-all answer for every organization, but there are ways, best practices, and different ways to look at that organization and see how it fits into creating a healthy space where people can feel comfortable raising their hand saying, actually, I'm struggling today. I can't come into work, or whatever the situation is, and have that be a response from the organization in such that is, okay, we get it. Come back to us when you're ready, right? That is not the case in a lot of organizations right now, unfortunately. So I can go on about exactly what we're doing, but I think I'll leave it there to let other panelists step in.
Yeah. No, absolutely. I just, I'm very inspired by the fact there has been this shift in perception from the employee perspective, because they're advocating for themselves. They're actually asking for what they need. They are asking more of their employers beyond just like salary and your basic benefits package. It's all encompassing and part of their experience at work. I do want to just go back and Joe, give you that opportunity to share some of the work that you do, and then we can dive right back in. So Joe, if you wouldn't mind.
I have anxiety now. The phone's going to ring. So just so you all know.
No.
I thought I had turned it off. My name is Joe Emery. I'm the Director of Human Resources for Hot Topic and Box Lunch. I've been with the company for over 20 years, actually, in the retail business. And my role has always been employee relations, development, and training. And so talking to people on a day-to-day basis about some of the issues that they have to deal with, especially in the last few years with the pandemic. As you can imagine, furloughing 8,000 people in one day, closing down all of our stores, reopening the stores, dealing with capacity issues, and all the things that we've had. I take 2 or 3 calls a week from a district manager, store manager, headquarters employee, just saying, I'm struggling. What do I do? I need some help. What are the resources that we have? So it is something that is much needed. And along with Susie, we tell people, take care of yourself, because it's total wellness. It's not just, I have the flu today or I'm not feeling well. I have anxiety. So we have been dealing with that now for quite some time. And I'm proud to be a partner of Mental Health America. As you know, we've been partners now for about 4 years, and it's a great organization with lots of great resources. So I appreciate having the opportunity to be here with you today.
Yeah, thank you, Joe. Does your anxiety subside now that the phone didn't go off for a second time?
The phone didn't
You
ring so
feeling-
much better, actually. Thank you.
Whose idea was it to put a bunch of people with lived experience now on a call together? I kid. But yeah, did anyone just want to, because I think we started off with a really strong question, is what is the responsibility of employers in creating that type of environment? Susie, I loved your response, but I just wanted to give others a chance to kind of chime in. And then we'll move into some of the more specific challenges that people have faced in the past year and a half. So Cal,
I
yeah.
think one thing we've done in construction is reframed mental health as a safety, health, and wellness topic. It's been an ongoing activity. We started this work with the National Action Alliance for Suicide Prevention back in 2010. And in 2012, we reframed it as the next frontier in safety. We were really trying to push those outer limits to get people to recognize employers can care for employees, not just at work, but when they leave work. So a big part of that movement was shifting the mindset of a safety 24/7 culture to focusing on getting people back to work safe from home, not just getting them home safe at the end of the shift. And that was really successful in construction. And the work that I've done now with the Executive Committee for the National Action Alliance has been focused on a blueprint for suicide prevention. The sad thing is, it was easier to talk to people about suicide prevention than it was mental health, and hardest yet to talk about substance misuse in the workplace. And it took the pandemic to kind of open up that opportunity to talk now about the full spectrum. And that's why I love partnering with Mental Health America. You're attacking it holistically, and that meta view that Susie just talked about.
Yeah, absolutely. And Cal, it's I've always enjoyed our conversations, because every time I participate in a training or just try to learn more about maybe some of the challenges that in construction specifically, it's really great when you have leaders and the decision makers of this industry coming forward and saying, we want to move beyond just the awareness, and they are more willing to have the conversations about suicide prevention and taking action. Whereas, and Susie alluded to it, this is not a conversation we were having a decade, even 5 years ago. So, Megan, I think you wanted to chime in there.
I know so many, people raising their hand all at one time. I love that, because that means that everybody has passion to truly begin to unpack this. And I think one of the things that really struck me with both what Susie said as well as what you said, Taylor, is that I think traditionally we have seen mental health as the responsibility of the individual to use your benefits, to take time off when you feel like you're not doing well, to find the right therapist that may support you. And we really see a shift into how is the organization, the structure within we see the modern workplace being one that supports people's mental health and well-being, and understanding that mental health is a disability. There was a great article in the Harvard Business Review that really began to dig into this concept, which says if we're going to modernize the workplace, we have to begin to think about that whole employee, and in fact, the structure, the environment in which that employee is experiencing. And so I really want to double down on the concept of how do we, as employers, think about the larger structures outside of HR that are at play here.
Yeah, absolutely. So just thinking about and I really want to direct this to Megan, Cal, and Joe, but Susie, of course, as well. But thinking about your industry, the environment that you work, what are some of those unique mental health challenges that you've seen your employees experience? And then just on the other end of that, it's like, how has leadership, responded or maybe not responded to some of these challenges? I'd love to start with Cal, if you'd like to share.
Sure. I think what's really interesting, I love Megan's perspective about structure. Our industry is split. We're a dichotomy. We have office workers, those that are administrative, and then we have hourly field workers. And so it's hard to think about that one size fits all. We're an industry that's dominated by small employers. So high concentrations of work are performed by companies with very small frameworks where even owners of companies are outperforming work. So finding the right path to reach each of them, is a special challenge. But during the pandemic, we were essential workers and really proud of how our industry responded. It caused challenges. The regulatory environment was always changing, ever changing. Susie's point about uncertainty, almost chaotic, adapting to new regulations, masking, now vaccination mandates. It's been tireless for the safety and HR professionals to kind of maintain orderly communications, being empathetic, being supportive, letting people know that they'll be okay. The lockdowns created some special challenges. Anybody that was fighting for sobriety, in the US population, that could be 10%. In construction, it could be as high as 15%. Lost access to AA and NA meetings. We needed to shift them to virtual resources. And so I think there's just a need for sensitivity that different populations have those different needs, and we have to adapt and scale tools to meet those needs.
Yeah, absolutely. Joe, did you want to add to that, and maybe some of the challenges that retail? And I know you've also got those different structure of the organization that probably face different things.
Yes, we do. We have 8,000 employees, but we have a good portion of those people in the stores, in the field, opening and closing stores every day. We have headquarters, which we're still not back to work yet. We work completely remotely. We're thinking about doing a hybrid, flexible scheduling type of model sometime in November, but of course that gets pushed out. And then we have a distribution center, and the distribution center ran the entire time, both of them, through this pandemic. So it was really it was very interesting. It was the anxiety of employees not knowing what to expect. As you can imagine, when we had to furlough 8,000 employees in one day, my days were spent just fielding phone calls about what's going on with the company, what's going to happen, are we going to come back, is there going to be a company to come back to? So there was so much anxiety, out there, and uncertainty, of course. And then when we started talking about potentially opening up the office, then the phone calls were about, I'm not sure I want to come back to the office, or I've got a child in preschool, or I have a kid, what do I do? So we've tried to be very understanding and very empathetic. Our CEO, Steve, is committed to, mental health and total wellness. So that's how we got involved with Mental Health America. I think I've told you the story. If I haven't, this was going to be an anti-bullying campaign within our foundation, and it became a mental health campaign. And that's how we found you, basically, because I thought Mental Health America was the best organization for us to partner with. And so we went from an anti-bullying campaign to a mental health campaign. It all fits in together. Being bullied as a child myself and knowing the anxiety I felt. So it all works together. But I've had many conversations all day long with employees, people crying on the phone. It's been interesting and tough for many folks. So we try to be as understanding as possible, providing them resources through EAP, through MHA, through the Trevor Project, which is another one of our partners. So it's been an interesting, challenging time, probably the most challenging time in my 35-year career in human resources, to be quite honest.
Yeah. I wanted to share and maybe humble brag with our partnership with Hot Topic, and that, one of the reasons why I'm so excited that we have this partnership is that not only was there, with the campaign and wanting to spread mental health awareness, this was like an internal and external approach. This was both looking at Hot Topic staff and the impact that, and this is even before pandemic, right? Like you were considering the mental health of your employees before it's become the hot topic, so to speak, but also how to share that with your consumers and your customers and your base. So
what was interesting is as you know, we have a resource card that we put in all our stores, and it has a suicide prevention hotline. It has our proprietary URL with Mental Health America, and we hand them out to all our employees and our customers. So every store has these resource cards, and that was an idea that I had because we wanted to provide a safe place for people. I don't know if any of you know much about Hot Topic, but we were the first company to make it okay to be different and work in the mall. You could have a green mohawk, you could have piercing, you could have tattoos and work in the mall. That was cool. We were the first company to do that. And we wanted to provide, and everybody always told me it's a safe place to be. And so that resource card was to provide a safe place, because I did not know until I started down this journey with you all that suicide was the number 2 cause of death for anybody under the age of 23. That was shocking to me, especially losing my father at 11 years old. I didn't know what suicide was. That wasn't in my vocabulary, but today it's a whole different thing. And so we wanted to help not only our employees, but certainly our customers, because that 11 to 23, those are our customers.
Yeah. Thank you so much for sharing that, Joe. And I'm sorry to hear that. I too, and I feel a lot of people probably who are listening in can relate to losing a loved one to suicide, and, or someone who's lived with depression, anxiety, or some type of mental health condition. Megan, I want to turn it over to you, but just folks who are in the chat and watching, I'd love to, if you want to kind of share some of the things that, if you're an employee or if you're someone who's job seeking, things that employers have done to help you feel supported. So this is very wide ranging, not just in terms of mental health, but what are some of the things that employers have done that, or that you wish that they would do to help support you and your mental health in the workplace? But yeah, I'd love to, Megan, turn it over to you and hear again some of the challenges that you've personally faced within your organization, and I guess what the response was to that.
I think across the industry, we have seen that people are moving jobs at an even more rapid rate. Some of the statistics show that 68% of millennials have moved jobs because of mental health. And in 4 years, 75% of the workforce will be millennials. In fact, 81% of Generation Z have moved jobs because of mental health. And so when we think about this as the way that we keep really important talent, making sure that we are focusing on mental health is one of the most important things that we can do. Now, this is a journey. I would never suggest that Microsoft, or probably most of us, have done everything right, but I do think there's a couple of key components that are important to be thinking about. And I know for our manager community here at Microsoft, the number one request was more training on mental health. They were really the frontline fielding and checking in on people. And I love that concept earlier brought up that this was a year and a half where someone checked in and said, "How are you doing?" It was okay to say, "I'm just okay," or "I'm not that great today." And I think that's really broken an important barrier and stigma, but we also need to nurture those employees and those managers to be able to, provide support, and also know when to signpost and make sure that employees and colleagues are getting the care that they do need within an organization. I will self-admit that I'm a nerd, so I think that hacking and technology and innovation have a really fun role to play here. And in fact, we are hosting our big 1-week hackathon here at Microsoft in just a week or so. And so we have the Mental Health Hack Challenge. And so to me, that's that opportunity to bring people with lived experience, people who have mental health conditions, together with the engineering excellence to say, how do we push the boundaries of what's possible? What is a way that we can begin to deliver better experiences for all of us as we are leaning on technology perhaps more than ever to gain access to education, to do our jobs, to be able to, see a doctor or stay connected with loved ones that combat that isolation. So I'm really eager to see how we come together as a community, not only at Microsoft, but truly across all of these industries, to say we have the responsibility and the opportunity to change the national conversation on mental health. And we can reduce the bias and stigma, not just through storytelling, but through great innovation.
Thank you so much, Megan. I really appreciate that response. So we left plenty of time for Q&A. Again, just a reminder, drop it in the chat if you do have questions. Before we move in, I just wanted Susie to give you an opportunity if you wanted to add to that, your perspective on this. If not, we can totally move on, but I just wanted to give you the chance there.
I'm hearing from Joe and Megan and Cal. What they're putting forth is what we're finding in our conversations with other organizations, which is doing the work of understanding the needs and really understanding where problem solving can happen. And that to me is amazing, right? We are in a whole different place if we're in that place. The Department of Labor has put out statistics that says 85% of businesses that have 500 employees or more offer an EAP. But the stunning statistic is that the utilization rate is between 4.5 and 6.5%. I mean, think about that. I think what we're moving into is an age that Joe and Megan and Cal are talking about is the EAP is not enough. It's one thing, taking a holistic approach and really understanding that it is the community that is going to uplift, the community that's going to support the spaces that we create within the environment of the organization is where we are headed, right? I don't know if anyone has heard this term, but we're starting to look at a community-based approach to self-care. And what that means is the burden shouldn't be on the individual to access the AP, like I said before, raise their hand. What we're looking for are organizations that understand that others need to be equipped and have the skills and have the understanding to identify when someone else is struggling so they can make the first move and say, hey, do you need a break? Do you want to take the afternoon off? Do you want to talk about something? That's where this has to go. The burden cannot be 100% on the individual to create the self-care plan, to suss all this out and what they need. It has to be a community-led approach because that's where you're going to find exactly what the needs are. And that's where you're going to help connect the dots around helping to support that person. And then you're going to see the ROI that organizations are always looking for. The healthcare costs are going to be lower. We're going to shift into a prevention and intervention mindset, right? Versus a crisis response, which obviously always has to be there if needed. But really where we want to see everything go is prevention and early intervention, so that we can identify before something gets out of control with someone and that someone can get the help that they need early on.
And I just want to
drop the mic, Susie. Please, Joe.
I just want to add on to something Susie. I'd like to add on something Susie said, and I think that's absolutely 100% true because we have had an EAP for years. I have to convince people that it's anonymous. People are so concerned about, is someone going to know my name? No, all we know is if someone called and they called about this. That's all we know. But I had that conversation over and over. And then also when you talk about making people aware of what's happening with others, we just did a training with all of our field folks, our district managers and regional directors with the help of MHA to really talk about mental health. So they felt a little bit better equipped. And that was the idea of a district manager who came to me and said, we need to have some training around this. And we did some of it a while back, and we just did it virtually a few weeks ago with Teresa from MHA. She did a fabulous job. And it was so well received because you're right, Susie, we just can't put the burden on everybody else because people don't want to talk about their mental health issues. They just do not. But if we can recognize something, then it's important for organizations to reach out and say, there's no stigma here. It's a safe place, a safe space, and you should seek the help that you need. So we're trying really hard to do that as well. So I just wanted to add that on there. Thank you.
So true.
You know, to me,
and then, oh, please, Megan, please.
you know, to me, what this really speaks to as well is the employee resource communities. And so, you know, having disability employee resource communities embedded into your organization and specific ones on mental health, as well as family and friends that are supporting people with mental health conditions, I think goes a long way to create safe spaces where people can be seen when they feel invisible, where they can ask questions in a place where they know they're going to get responses from people with other lived experiences. And I think that really goes to building that foundation of psychological safety in which people are willing to raise their hand and say, I do live with a mental health condition. You know, very quickly on December 10th, we're going to be celebrating World Mental Health Day. And so we asked employees, hey, would some people be willing to share their story? And I was overwhelmed with the number of responses that we received, because increasingly people do want to tell their story and they do want to normalize mental health as part of being human, and certainly part of the way that we have experienced the global pandemic over the last year and a half.
Absolutely.
Yeah.
Taylor,
Cal, did you
to
have something there?
go back to Susie's point about the community. We were very intentional about building that prevention strategy. What we did was a media saturation campaign and an association penetration campaign. We now have associations that are building in a culture of care initiative and total human health into their safety, health, HR, and diversity, equity, and inclusion frameworks. Labor unions have been responding, talking about mental health, substance misuse, suicide, and overall well-being. And that's how we were building this collective culture, like Susie described, that community approach for employees and their families to break down those barriers and to let people know it's okay to not be okay, but also resources are available. And sharing information like crisis hotlines. Today I had a message from a new organization that wants information on screening. So I pointed them toward Mental Health America and your screening tools. There's just so much positive that's going on. And that community approach is going to build peer-to-peer networks. We see them work in substance misuse, treatment and recovery. And if we can do that in the job site, in the workplace, we'll be all the better for it.
Yeah. I love that you mentioned the screening and the peer-to-peer, two things that we're big advocates at, and I think definitely apply in the workplace setting. So I think I'm going to move and take some questions from our audience here. The chat has been blowing up. I did want to make a call out to someone who, you know, mentioned something that supported them from their employer was lower copays, access to telehealth, things that employers are kind of introducing as a new and different way of seeing benefits has been beneficial to people. So the first question I wanted to kind of start with, because it's a particular area of interest for me, and it was a question from Amy. And I think I'm going to start with you, Megan, because we've had conversations about managers and the relationship, you know, that has an impact on employee mental health. So do you think, and of course anyone's welcome to jump in as well, but I'll start with you, Megan, but do you think that mental health, mental illness, mental disability is something that's becoming less taboo to discuss with your manager or your supervisor? So that relationship in particular.
You know, I think that the disability journey and self-disclosing, you know, your own mental health condition with a manager is an incredibly personal experience. And so I think that varies greatly depending on the relationship that you do have with a manager, depending on the level of psychological safety that exists within the organization. But what I am personally saying is that there is more of a desire to have openness around the realities of what our current work life looks like. One of my favorite quotes that came from some research that we did this year was like, There's no, home Kyle and work Kyle. There's just Kyle. And so being able to think about how employees and employers, really are a holistic, life experience. And so, I think that, having emotional intelligence and being a manager that's ready to have that conversation is really important, and learning about the accommodations that are in place within your organization so you feel confident and comfortable supporting that individual when they do come forward is really important. And so I can't encourage people enough to lean in, learn more. What do you have at your company? Where are the places you feel like you have the opportunity to grow? We're all lifelong learners. I certainly don't know everything, but I do know that we have the opportunity to begin to ask ourselves how we support those around us and how we build teams where people feel confident coming forward because they know that they're going to be met with an open mind and a good dialogue.
Yeah, absolutely. And I think that the truth is as you mentioned, Megan, it really is dependent on that relationship and on that manager, because I hear, from a broad range of experiences from employees where some managers are very open to talking about these things. And even something as simple as saying, how are you doing? How are you feeling before we kind of launch into the details of your next project? Let's just start there. Or even just asking about stressors, like very basic things that if people aren't ready to launch into maybe those more difficult conversations, it helps to kind of start with the, even asking not just from the manager to employee, but employee to manager, how they're doing, checking in with them and kind of establishing that type of relationship.
I think the check-in is so important. I love that you bring it up, the check-in, because what we've seen is that when managers check in and have a regular one-on-one with their employees, that is one of the most important components of well-being, and having a sense that there is a space in which people care about an individual. And we've also seen that overall work hours go down. So over the pandemic, we have seen work hours increase for almost every kind of job out there. So just if you're a manager, think about the way that you're checking in, asking how people are doing, as a way to not only be thoughtful about someone's well-being, but helping them find that the prioritization so that they can get great work done and then disconnect and get the downtime that they need afterwards, right?
Yeah, for sure. Yeah. Anybody else? Just your opinion on is it becoming easier or harder to have these conversations with your manager or supervisor? Or also, I'd love to hear about your personal experience too. Joe, you you shouted out to Teresa, who provided a training for your staff. She's my supervisor, and I got to say, I would not be where I'm at if I didn't have that type of support and guidance. So, yeah, Joe, if you wanted to.
I'll just say something very short. I've said this my entire career in human resources, and the reason I got into human resources, not because you don't get into human resources because you like people. You get into human resources because you believe in people, and it's the most important asset a company has. That's why you get HR. That's why I did it. People work for people. They don't work for companies, and so that connection with a manager or supervisor is so important. And my own experience, if I've had a really tough day, and as you can imagine, dealing with 1,000 employees, I can have some pretty tough days in the ER world. I shout out to my boss and say, I need 15 minutes of your time just to talk, just to check in, just to chat. That's all. I just need and at the end of that, I feel great. And it really helps me. And I do so many exit interviews with people, because we do exit interviews on all folks that leave Hot Topic. And what is the biggest reason? Besides, money is always sometimes an issue, but one of the biggest reasons is I didn't have a connection with my supervisor. And so I believe so much in emotional intelligence and having the strength around that. And no matter what communication behavioral style you are, you can have emotional intelligence and connect with people. You just have to know how to do it. So I do a lot of facilitation around that. And I just think it's so important that people understand they work for people and they want to be cared about. That's all.
Yep. So absolutely. I did want to kind of move on and try to get some more questions in here from our audience. So, burnout has been an incredibly prevalent issue. It always has, but now it seems like the pandemic's kind of exacerbated that as an issue. So a question from Nicole. She says that a common issue is that employees are not using their paid time off because there's just so much to be done, and they don't want that workload to pile on if they take that time off. So how can, as leaders, as managers, as coworkers, how can we help employees feel better, okay, taking that time off to avoid burnout and avoid getting to those stages that make your work, quite frankly, more difficult to do. So this, I mean, Susie, if you wanted to kind of start us off here.
Sure, absolutely. It's really interesting. There's a meme, and I'm not making light of it, but this meme has really stuck with me. And it says, having a job is weird because we're in the middle of a major extinction event, which really speaks to me that we need to define, I know, right? I'm not making light of it, but really we need to define what burnout is, because I think there's some invisible, unseen factors that are affecting our health. And, Cal, pointed to the social justice conversation, the equity conversation, and as well as I'm trying to be productive. And also with all of this uncertainty and unknown, and I don't know how I need to show up as a human to work, right? So there are these bigger questions. So there are layers that are impacting, quote unquote, burnout. And I really love where Joe was headed with, how employees are supported. And one of the ways that we're finding is incredibly effective is making sure that these conversations, the check-ins that Megan was talking about, is a part of the DNA of the organization. And we are not just relying on the programmatic and sporadic trainings. Those are important, but not just relying on those to have the conversation live just there. Megan talked about the importance of, helping folks to raise their hand and identify when it's on the disability train, but we're all on a mental wellness journey, right? Everyone, this is, there's no othering here. Everyone is on a mental wellness journey. My lights just went out. See, unpredictably and uncertainty. So, back to your question about burnout. What are we talking about when we say burnout? Is someone burned out from the job, or are there, to take a cue out of where healthcare is going, are there social determinants of health that need to be addressed? What is the layers of burnout, right? Because we're finding in the conversations we're having that for the remote workforce and people that have had to shift how they work and where they work, productivity is not down. People are working more than ever, unfortunately, right? There's no travel time in between meetings. So they're filling that with work. Your laptop might be in your dining room, right? So we need to really understand and get at the layers of in defining for that particular culture and organization what burnout actually means, because it's different for a frontline worker than it is for, someone working in retail or in other areas. Not good, bad, but just different, very, very different. So I know that was a bit of an ambiguous thing, but I think where it needs to start is defining what burnout looks like and then get going from there.
Yeah. I feel personally a little called out. I'm like, I am now sitting at my dining room table with my laptop and have been for the last year and a half. And it's not as fun as I feel like I thought it'd be when we first started all of the working from home business. But Cal, I miss hearing your voice, and I wanted to see if you wanted to chime in with the issue of burnout and how that kind of plays out in construction.
Taylor, recently the Center for Workplace Mental Health and the Construction Financial Management Association did a survey with my employers around mental health in the construction industry. We addressed a lot of these topics. Burnout is really the number one topic that people are now talking about. So the survey was designed to focus around breaking stigma, but the number one issue that people are discussing is burnout. So you think about the World Health Organization and their definition of burnout as an occupational phenomenon. But everyone's talking about burnout, not just at work, but in home, in relationships, in families. everyone's under this stress. One thing that we should call out as a big workforce challenge is still daycare. The number of families that lost jobs, the hybrid schools, all these pressures are, I think, contributing to the underpin of burnout. So when your job demands outstrip your available resources, people do feel burned out. We've talked a lot about those structural aspects. We've talked about needing to take time. I love the check-ins. I love the one-on-ones. One strategy I've seen companies using is an old-fashioned annual calendar where teammates, either electronically or on a board, are listing their scheduled time off. It's holding more people accountable for people to see it. And it's a simple little technique, but it's one that I'm having now with a lot of employers. How are you tracking? Are people truly taking time off? And it's letting people know the expectation is that you'll take time off. The last item, a few high-profile companies have done weeks off or extended weekends or summer hours to give people more time for time off. So I see some heads nodding. Those, I think, are going to be modeling really good examples of how we can avoid or prevent burnout.
Yeah, those are fantastic suggestions. That's something MHA had done, was the summer hours, and it made such a difference in getting our work done and helping with that workload management. I want to just keep going and let all of you just talk forever, but I'll pose one more question and then we'll close it out. And I really like this question. It's from Tanya, who asks, what is the single most important step all employers should take for enhancing mental health in the workplace? So kind of what's that key takeaway, and what can employers be doing? What's the first thing they should do to really enter the space and improve employee mental health? And I'd like to, kick that to Megan if you want to start us off. And this is for everyone. I'd love to hear everyone's thoughts on this.
I like how you saved the hardest question for last. That is really, where do you start on a journey that, is such an important one? And so, to me, I think that there's a couple of components, which goes back to structure. Do you have an employee resource group in place, or or some of those peer support groups? Do you have, a cross organization senior leadership team that is addressing that strategy on mental health, so that it's not owned in pockets or in silos, but in fact, it's an open conversation about where the entire business wants to be, so that you can be connecting it with the different kinds of employees that you have, the different kinds of departments. And I think just for me personally, I, have, my personal tip is really thinking about how to create boundaries. I'm much more thoughtful about what my work hours really look like. And as a manager, I am very clear that I do not email people after hours unless we're having some kind of an emergency. And so senior leaders and managers play such an important role in the way that we model good behavior. And I think that goes back to what we said earlier, which is I take vacation and I don't get back on to check email, because that's what I want the people around me to do. And so, think about not only the organizational structure, but what can you as an individual do every single day? Because inclusion is a verb. It's what you do. It's how you show up. It's not a state of being. And each one of us has the opportunity to make meetings more inclusive, to make the workplace more inclusive. And that certainly couldn't be more true for emotional inclusion.
Megan, I love how you're like, did you just ask us how we solve workplace mental health? That's a difficult one, right?
We're like, just go for it. Yeah. Thanks, Taylor. Somebody out there said you forgot something very important. I know it is. So I'm relying on my panelists right now to fill in all of the wonderful gaps that I didn't get to in my moment there. So take
Megan,
it away.
I appreciate, and just like this group is just so humble, because I know all the work that you all do in this space, and it is a journey. It's not, it isn't going to be something that's solved overnight. So no shade. You're just like, yeah, that's a question to end on. But yeah, Joe or Cal, and then Susie, any kind of your 2 cents for this, please.
I think I'll start by, as I said, this was really it does need to be pushed. And I love the fact you said this, Megan. Senior leadership plays a huge role in this by taking vacations, taking time off. Making sure that people are taking care of themselves. Steve, our CEO, who is just incredibly great. When we have a long weekend or we have a half day, we have half days, and he said, make sure you take your half day and don't schedule any meetings. Or if you are going to be on vacation, because I'm not going to answer emails. And it was interesting because we just had our staffing director, Michelle, just went to Hawaii for 2 weeks. And it was a big family vacation. She had planned on it for a long time. She took her mother, extended family. And she says, well, I'll be on email. I said, no. I said, I don't want to hear. No one wants to hear from you. Take your time off. Because I said, here's the deal. And I really, truly believe this. And I don't want to sound morbid. If anything happens to any of us, the company's still going to go on, right? The work is still going to be here. So take your time off and then come back and deal with the 5,000. I get the email deal because I get hundreds of emails a day. But take your time off, recharge, relax. And I think our senior leadership plays a big part in that because he's a huge believer. For example, he doesn't like anyone to have any meetings during lunchtime. So I don't have meetings during lunchtime. From 12 to 1, there are no meetings. I may get a phone call on occasion, but no meetings. So that thing about senior leadership and management needing to be involved in it, it's very important because it'll trickle down, and we have to set the example for that. I'm probably the guiltiest person in the entire world of not taking time off, although at 5 o'clock I'm done. And I tell people that at 5 o'clock my computer goes off, and unless there's an emergency, unless there's a shooting in the mall or something crazy terrible happens, don't reach out to me because that's my time, and I recharge by taking walks and exercising at night and that sort of thing. So that's how I do it, and it works for me. But it's very important to escape, the day to day.
Yeah. I hate to do this, but Cal and Susie, if you just wanted to add a 30-second, a thing here, that would be wonderful. And then we're going to wrap up today's discussion.
Yeah, can't underscore enough the importance of modeling that good behavior, like Megan and Joe have both shared. I think building a caring culture to really create a mentally healthy, psychologically safe workplace is the most important thing. If you were to pick one, it's building that caring culture so people see you, be visible, be vocal, and really share your lived experience. Those would be things that will let other people know that they're understood and that the company does care about them. Susie, I tried to save you some time.
Big thumbs up to everything that Joe, Megan, and Cal shared. I would say directly to leaders of organizations, set your people up for success. So whatever that means, whatever infrastructure you need to put in place with middle managers, with everyone within the organization, create an intentional pathway to supporting your employees and understand how your culture and your values play into and can support this journey, and how you can set everyone in the organization up for success. I think I'll just leave it there because I think what everyone else shared is incredibly valuable. So thank you.
Perfect. Thank you so much, Susie. So we are at time today. I just want to thank everyone in the audience who joined us today and dropped their thoughts and feedback and questions into the chat. A special thank you to our panelists, Joe, Susie, Megan, and Cal, for bringing their perspective to this conversation. I genuinely enjoy having this type of discussions with you. To GBH and PBS Future of Work Initiative for sharing stories from their documentary project for the event. And to the funders who made this conversation possible, including the Corporation for Public Broadcasting. This initiative has 2 more events coming up in the month. So next week on October 13th, there's a conversation about women and work post-COVID-19. On October 26th, there is a discussion about seniors and the multi-generational workplace. So a lot of awesome content there. Also, I encourage you to check out the work of MHA, as well as all of our panelists have really incredible things that they do. MHA has a Bell Seal for Workplace Mental Health that Susie mentioned, which is a national employer certification program to recognize those employers who are committed to creating those mentally healthy workplaces. You can find more information at mhanational.org/best employers. I know I'm talking at the speed of light. I'm sorry. And finally, you can watch more story like Catherine's that you saw at the beginning of the discussion here, and clips from that 3-part PBS documentary Future of Work at pbs.org. So I want to say thank you to all of you. Thank you to panelists in the audience, and I hope you enjoy the rest of your day. I can say I personally really enjoyed this, so thank you.